Most people believe that falls happen outside the house, on the staircase, on uneven roads, in crowded markets, but the most dangerous moment of the day often comes before your feet even touch the floor. In those first few minutes after you wake up, your muscles are still half asleep, your joints are stiff, your nervous system has not fully switched on, and if you are over 75, that single unprepared step out of bed can quietly increase your risk of losing balance. Dr. Javier Morales has spent more than 30 years working with older adults in orthopedic surgery and rehabilitation settings. Over and over again, he noticed the same pattern. Many patients who once walked confidently began to shuffle. Their posture changed, their balance weakened. It was not always because of disease, and it was not simply because of age. It was because their bodies were not being activated before bearing weight each morning. There is a big difference between stretching and activating. Stretching makes a muscle longer. Activation switches the muscle on. Activation prepares your joints to stabilize your circulation to improve and your brain to coordinate movement safely. Without activation, your first steps of the day happen with reduced support and slower reaction time. That is when instability begins. Today, Dr. Javier Morales will guide you through 7 simple bed exercises ranked from least impactful to most powerful. The entire routine takes less than 15 minutes. No equipment, no gym, just your bed and your consistency. Stay with me because number 2 may surprise you. And number 1 is the exercise many specialists consider essential for protecting independence after 75. Let us begin with number 7. Let us begin with exercise number 7, a movement that many people overlook, but one that plays a very important role in your balance. Number 7, toe spreads and toe curls. Your toes are small, but they carry a big responsibility. They help you feel the ground, adjust your balance, and stabilize your body with every step you take. As we age, especially after 75, the muscles in our feet begin to weaken. This happens slowly, often without pain, which is why most people do not realize it is happening. In many homes across India, floors are smooth and we often walk barefoot or in soft slippers. While this is comfortable, it does not challenge the muscles of the feet enough to keep them strong. Over time, this can reduce your ability to sense the ground beneath you, making balance more difficult. To perform toe spreads and toe curls, lie comfortably on your back. Start by spreading your toes apart as wide as you can. Hold for 3 seconds. Then gently curl your toes inward as if you are trying to grip the bedsheet. Hold again for 3 seconds. That is 1 repetition. Perform 10 repetitions slowly and with control. This simple movement improves the connection between your brain and your feet, helping your body respond faster when you shift your weight while standing or walking. Now let us move to number 6, ankle pumps and circles. When you lie in bed for several hours, blood circulation in your lower legs slows down. This can lead to stiffness, heaviness, and swelling around the ankles. For older adults, especially those who spend more time resting, this reduced circulation can also affect balance when standing up. Ankle pumps and circles are one of the easiest and most effective ways to wake up your lower legs. Lie on your back with your legs extended. Point your toes away from you and hold for 2 seconds. Then pull your toes back towards you and hold for 2 seconds. Repeat this 10 times. After that, slowly rotate your ankles in a circular motion 10 times clockwise and 10 times counterclockwise. Move slowly and focus on full controlled motion. This activates your calf muscles, improves blood flow, and prepares your ankles to support your body weight safely when you stand. We have now activated the foundation of your balance, your feet and ankles. Up next, we begin preparing your knees and joints for smooth movement with exercise number 5. Now let us continue with exercise number 5. This movement focuses on one of the most common complaints among older adults, morning knee stiffness. Number 5, heel slides. Many people over 75 experience discomfort in their knees when they wake up. The joints feel tight, movements feel slow, and sometimes there is even a cracking sound when bending the knee. This is not just a sign of aging, it is often because the joint has been inactive for several hours during sleep. Heel slides help gently restore movement in the knee without putting any pressure on it. Lie on your back with both legs extended. Slowly slide your right heel toward your body while keeping it in contact with the bed. Bend your knee as much as feels comfortable, then hold the position for 3 seconds. After that, slowly slide your leg back to the starting position. Perform 12 repetitions on each leg. This movement helps circulate the natural fluid inside your knee joint, which acts as a lubricant. When this fluid moves, the joint becomes smoother, less stiff, and more prepared for walking. Now we move to exercise number 4, where we begin strengthening the muscles that help lift your legs when you walk. Number 4, supine marching. As people age, many begin to shuffle instead of taking full steps. This happens when the muscles that lift the legs become weak. When the feet do not lift high enough, even a small rug, uneven floor, or doorstep can become a tripping hazard. To perform supine marching, lie on your back with your knees bent and feet flat on the bed. Place one hand on your lower abdomen. Slowly lift your right knee toward your chest while keeping your lower back pressed gently against the bed. Hold for 2 seconds, then slowly lower your leg back down. Repeat the same movement with your left leg. Aim for 15 repetitions on each side. Focus on slow and controlled movements. This exercise strengthens your hip flexors and core muscles, which are essential for safe walking and maintaining balance. With your knees and leg lifting muscles now activated, we are ready to move into exercises that build deeper strength for standing and daily movement. Up next is exercise number 3. We now arrive at exercise number 3. This movement focuses on one of the most important muscle groups for maintaining independence after the age of 75. Number 3, straight leg raises. The muscles on the front of your thighs, known as the quadriceps, play a vital role in almost every daily activity. They help you stand up from a chair, climb stairs, and support your body when you're walking. As we age, these muscles gradually lose strength, especially if they are not used regularly. This loss of strength can make simple movements feel more difficult and tiring. To perform straight leg raises, lie on your back with one knee bent and the other leg extended straight on the bed. Tighten the muscles in your straight leg by gently pressing the back of your knee down toward the mattress. Then slowly lift that leg until it reaches the height of your opposite knee. Hold this position for 3 seconds and then slowly lower your leg back down. Repeat this movement 10 times on each side. This exercise strengthens the muscles that support your knees and help you move with confidence. Over time, you will notice that standing up and walking feel more stable and less effortful. Now let us move to exercise number 2, a movement that many people do not expect, yet it plays a crucial role in balance and stability. Number 2, hip abduction. The muscles on the outer side of your hips help keep your body steady when you stand on one leg. Every time you take a step turn or shift your weight, these muscles work quietly to keep your pelvis balanced. When they become weak, your body may sway more, while walking increasing the risk of losing balance. To perform hip abduction in bed, lie on your back with your legs extended. Slowly slide your right leg outward to the side as far as you comfortably can, keeping your toes pointing upward. Hold the position for 3 seconds and then slowly bring your leg back to the center. Repeat this movement 10 to 12 times on each side. This exercise strengthens the stabilizing muscles of your hips, helping you feel more secure when standing, turning, or walking on uneven surfaces. We are now just one step away from the most powerful exercise in this entire routine. Up next is exercise number 1, the movement that supports your posture, your strength, and your long-term independence. We have now reached exercise number 1. This is the most powerful movement in this entire routine and the one that can make the biggest difference in your ability to stay independent as you age. Number 1, glute bridges. There is a reason why many orthopedic specialists consider this the most important bed exercise for older adults. The glute bridge strengthens the muscles along the back of your body, including your hips, your thighs, and your lower back. Together, these muscles form what is known as the posterior chain. This group of muscles plays a crucial role in keeping your posture upright and your movement stable. As we grow older, especially after 75, these muscles tend to weaken because we spend more time sitting or resting. When the muscles along the back of the body become weak, the pelvis tilts forward, the spine begins to curve and balance becomes harder to maintain. This is one of the main reasons why many older adults develop a hunched posture and feel less steady when walking. Glute bridges help reverse this pattern by reactivating the muscles that support your body from the back. To perform this exercise, lie on your back with your knees bent and your feet flat on the bed, placed about hip width apart. Your feet should be close enough that your fingertips can almost touch your heels. Before lifting your body, gently tighten your hip muscles by squeezing them together. Then slowly push through your heels and lift your hips upward until your body forms a straight line from your shoulders to your knees. Hold this position for 5 seconds while breathing normally. After that, slowly lower your hips back down, taking about 4 seconds to return to the starting position. Repeat this movement 10 times and aim for 3 sets, resting briefly between each set. Move slowly and focus on control rather than speed. The goal is to activate the muscles deeply and consistently. With regular practice, this exercise can improve your posture, strengthen your walking ability, and make daily activities feel easier. More importantly, it helps protect your independence by giving your body the strength it needs to support itself confidently. You have now completed all 7 exercises that prepare your body for a safe and steady start to the day. In the next part, we will bring everything together and show how these simple movements can create powerful changes in your daily life. You have now seen all 7 movements that can prepare your body before it carries your full weight each morning. From activating the small muscles in your toes to strengthening the powerful muscles in your hips and back. This routine is designed to wake up your entire support system. Not with strain, not with heavy equipment, but with intention and consistency. Dr. Javier Morales often shares a simple belief from his decades of clinical experience. Aging is natural, but rapid physical decline is often preventable. In his work with older adults, he has repeatedly seen that those who stay consistent with small daily activation exercises maintain their confidence longer than those who rely only on occasional stretching or rest. In his personal view, the greatest risk after 75 is not weakness alone. It is hesitation. The moment someone begins to fear movement, they start moving less. And when they move less, the body weakens faster. That cycle can begin silently, but it can also be interrupted. This routine is one way to interrupt that cycle. However, it is important to say clearly that this video is for educational purposes only. These exercises are general recommendations based on common rehabilitation principles. They are not a substitute for personalized medical advice. If you have severe joint pain, recent surgery, uncontrolled blood pressure, or any serious medical condition, please consult your doctor before beginning a new exercise routine. Your safety always comes first. For many older adults in India and around the world, independence means dignity. It means walking safely inside your home. It means visiting places of worship. It means being active with grandchildren. These daily freedoms matter deeply. Start tomorrow morning. Even 5 repetitions of each exercise is a meaningful beginning. Progress does not require perfection. It requires commitment. If this message resonates with you, share your age and the city you are watching from in the comments. Your story may encourage someone else to take their first step towards stronger mornings. And if you would like more practical guidance designed to protect your mobility and independence, consider subscribing. Your future self will thank you for every morning you choose to move with intention.